Many women have a tilted womb and don't know if this condition may affect their chances of getting pregnant. So in this video, let's discuss what is a bent or tilted womb. Just how does it affect your chances of getting pregnant? And how do you go about getting pregnant if you have a bent womb? Hi, welcome. I'm Dr. Sylvia, a consultant in general practice. This is AskAwayHealth. You'll be glad you stopped by here today. Give this video a like, consider subscribing to the channel, and let's just dive straight into the topic. Did you know that 1 in every 4 or 5 women is walking around with a bent or tilted womb? So what is a tilted womb? Well, most women have a forward tilting womb that looks like what you can see on the screen right now. It means the upper part of the womb lies angled forwards slightly and tipped towards the bladder and the front of the body. On the other hand, the term bent or tilted womb is used whenever the womb tilts away in the opposite direction towards the back, as you can see in these set of images. So what does this mean physically? How do women get it? Could you tell if that is what is happening to your womb? Mostly, having a bent womb is something down to your genetics and you're born with it. But sometimes the direction in which your womb is lying can change due to certain conditions. For example, when the pelvic muscles that hold up the womb are weak, such as during menopause or after previous childbirth, the womb can angle backwards. Another instance, when the womb is enlarged during pregnancy, or if there is a mass in the womb like somebody who's got fibroids or cancer, this can cause the womb to be tilted back. If a woman has internal scars, also known as adhesions, from previous surgery or infections like PID, pelvic inflammatory disease, or from a condition like endometriosis, those scar tissues can pull on the womb, making it tilt backwards. Well, with a tilted womb, most women have no symptoms. But if you do get any symptoms, they may be things like pain in your lower abdomen or pelvis and during sex, developing pain in your lower back, which can also happen during sex, experiencing problems with bowel opening, for instance, frequently getting constipated. You may experience menstrual pain or cramping. Some women may even occasionally leak urine, that is, they're incontinent of urine. And sometimes wearing menstrual products like a tampon can be uncomfortable if you have a tilted womb. How do we make a diagnosis? Well, this could happen during a pelvic examination or via an ultrasound scan. So let's talk about it. Could a bent womb affect the chances of pregnancy? Now, contrary to what you might think or believe, having a bent womb does not usually affect your chances of becoming pregnant. Another way to look at it is if doctors are exploring the possible causes of fertility in a woman, the tilted womb is not going to be on the top of the list of possibilities. A bent or tilted womb does not mean that the fallopian tubes are blocked, or that the cervical canal is abnormal, or that there are problems with ovulation or hormone balance. But once we've checked other more common causes like hormone problems or tube conditions, then we may look at an abnormal womb structure if this is present as contributing towards fertility issues. But think about it. If you experience pain during sex, that could affect how often you have it, and so could affect fertility. So if you have a tilted womb and experience painful sex or back pain during sex, considering alternative positions can be helpful. The best examples are shallow positions like spooning or the modified missionary position, which unfortunately I can't show you any images because of YouTube's community guidelines. The other thing, of course, is experiment with your partner to find out which position suits you best and have sex regularly if you're trying to get pregnant. Some people also think that because the womb is bent, it might prevent the sperm from getting to where it needs to for fertilization to happen. But again, that impression is not correct. But if it makes you feel better, you could place a cushion or pillow under your hips during sex, or stay in the same position for about 30 minutes afterwards. It might help. If you want to get pregnant and you've been told you've got a tilted or bent womb, relax. You will most likely have no problem falling pregnant. In fact, pregnancy itself causes the womb to tilt back as it grows. In most cases, your baby grows fine and there are no problems with labor or delivery. So generally, a bent womb doesn't cause any serious problems, but it's good to see if there's an underlying cause. Pelvic floor exercises could help strengthen weak muscles and improve the womb position. While some women may need a ring pessary to hold the womb in place, check out this video I just did on vaginal rings to learn about how that works. Let me know if you have any comments on the subject or if you want to share your experience with getting pregnant or having a tilted womb. You can also check out some more videos in my How to Get Pregnant with series. Give this video a like and share it with a friend. Thank you so much for watching. Remember to subscribe to the channel and I'll see you again soon. The best positions are shallow. The best positions are shallow positions.